Hello to everyone who is watching for this session of the RSC's first virtual conference. This session will be on the report of the RSC's COVID-19 task force. My name is Andrew Coyne, by the way. I'm a columnist with the Globe and Mail, and I'll be the moderator for the session. We're going to be looking today at the report of the RSC's COVID-19 task force, which has a dozen illustrious names attached to it. We have four of perhaps the most illustrious with us today. And I'll just introduce them, I guess, in alphabetical order, and perhaps you can wave as I say your name.
And I got my regular toolbar.
You get your regular what? I didn't hear that.
I don't think it was one of us.
Ah, okay. So first of all, we have Evelyn Forget, who's a professor in the Faculty of Health Sciences at the University of Manitoba. Richard Gold, professor in the McGill Faculty of Law and McGill Faculty of Medicine, and a senior fellow at the Center for International Governance Innovation. Third, we have the chair of the task force, Christopher McCabe, Chief Executive Officer of the Institute of Health Economics and professor in the Faculty of Medicine and Dentistry, University of Alberta. And finally, Lindsay Tedds, Associate Professor, Department of Economics and Scientific Director of the Fiscal and Economic Policy at the School of Public Policy in the University of Calgary. So what I think we're going to do is start off with each of the panelists will give a short presentation of, I guess, their area of focus within the report, and then we'll get into questions from me, and then we'll do some questions from the audience, I guess, if I can figure out how to work that. But let's start first of all with I think it's Chris is going to start off.
Thanks, Andrew. Thanks for that very kind introduction, and welcome everybody. I'm really pleased that you could find time to spend this hour with us this afternoon. So if we can just bring up the next slide, please. So I was privileged to chair the working group on the economy and relaunching the economy after COVID. And there are 12 members of that. And you can go onto the website to see who they are. But golden rule of my career is always make sure that everyone in the room with you is smarter than you are. And it worked just fine this time. And before we get into telling you about the core recommendations of our report, I think it's worth taking a moment to say and to recognize that public servants across the country have performed amazingly well. They've performed miracles over the last 10 months since the crisis broke. Not just the frontline workers, the health workers who have just been astounding, but also the people working in the governments and the municipalities. From a standing start, they have created infrastructures to look after our societies, to look after our fragile and less fortunate members of our society. So I think it's really important before we start into a discussion of maybe what didn't go so well, that we recognize their massive efforts and that we would have been in a much worse situation without their contributions over these 10 months. So we were charged with answering the question, how do we build back better? How do we make sure that the Canadian economy that leaves COVID, that we build after COVID, is better than the one that went into it? And so what I'm going to briefly talk about is what happened. What has happened in the last 10 months? So between third week of January, third week of March, we went from having no cases to established community transmission. More people were getting the COVID infection from other people in society than from people who came from outside. And once you've got that established community transmission, then you are at risk of a pandemic. So in 2 months, we went from nothing to the threat of a pandemic. We now have had over 300,000 cases. We have had over 11,000 deaths. And across the country, on average, we're running at a 2.5% positivity test rate. Economic activity collapsed. There's been some recovery, but what's most notable is that the burden of that collapse was not shared across Canadian society. The largest burden fell on the precariat. So those people who lived wage check to wage check, they don't have savings to fall back on to see them through hard times. And usually they're in jobs which don't give them the option to work from home. They can't afford to quarantine if they do get infected or they get exposed to somebody who's infected. And thus the impact of COVID followed the lines of the inequalities that we see across our society. Next slide, please. It wasn't like we haven't been warned. Remarkably, this is the 4th infectious disease outbreak of this century. We had SARS, we had H1N1, and we had Zika. Fortunately, those previous ones were either not very infectious, so they didn't spread, or they didn't have a large mortality rate. They were relatively minor. And we had effective, certainly in H1N1, we got effective therapies in place really quickly. Because we didn't learn the lessons and we didn't make the investments that were recommended by the post-outbreak inquiries, we once again had an ineffective national coordination of the pandemic response. We didn't have the early warning of the seriousness of the COVID-19 threat. For a long time in this century, Canada had a world-leading early warning system for infectious diseases. It was effectively closed down in November 2019. The timing could not have been worse. And so we didn't get that early warning. And we had an inadequate intelligence capacity and policy development capacity to identify the economic, social, and educational impacts of different interventions. There was a very clear and strong focus on the protecting the health systems, but the information about the impact of the policies to protect the health systems didn't seem to be there, didn't seem to be part of the evidence base informing the policy discussions that led to the decisions that governments made. And at the same time, and they should be applauded for this, the federal government committed 300 billion essentially in this year to, in essence, protect our social fabric because the supports weren't there for so many people in our society for them be able to follow the advice that was given by public health departments across the country. Next slide, please. So in summarizing the lessons, and my colleagues are going to talk in more detail subsequently, what we observed when we looked at what had happened and what had gone wrong is that for Canada to be resistant and resilient against future pandemics and future crises more broadly, we have to have all people being able to access the financial and social capital reserves, that they can act in line with the social good. They can quarantine if they need to, if we ask them to protect the rest of us. A high quality response to the future crisis requires a permanent and nationally coordinated resource of experts that can evaluate and communicate not just the impact on the health system, but the impact on the economy, the impact on social functioning and education, etc., of a range of different policy responses. And as we look forward and consider what to do when we relaunch the economy, it's very important that we seek to align Canada's economy going forward with the global economic shifts to enable the long-term innovation that's going to be necessary for us to have a robust economy to be able to respond to future crises. And that's going to have to be done through targeted public sector investments. So I'll hand over to Evelyn now, please.
Thank you, Chris. Next slide, please. We recognized that if we were going to enhance resilience within the economy, that we needed to reinvest in the social contract. And we thought about that on the basis of three principles. First of all, we recognized that all members of society should have equal worth, voice, and status, regardless of personal characteristics. And equally, all members of society should have equal opportunity to realize their potential and to contribute to society in a meaningful way. We also recognize the importance of community, and in particular, Indigenous communities. And we recognize that the routine use of the UN Declaration on the Rights of Indigenous Peoples in all negotiations between various levels of government and Indigenous communities would allow that document to develop as a living document and to inform Canadian development going forward. Next slide, please. We recognized 3 gaps that needed to be addressed. First of all, there was a lack of social protection. Social protection needed to be enhanced. We wanted to ensure that economic dynamism, economic growth could be enhanced through the tax policies that reward innovation and productivity. And we wanted to ensure greater equality of access to basic public services, including health, education, and environment. Next slide, please. Specifically, we looked at recommendations that would allow us to fill those gaps. We recommended that the federal government should take leadership in developing and implementing a basic income guarantee as part of a robust social safety net. This would be an income contingent basic income guarantee aimed primarily at working age adults. We see the development of basic income as part of a broader tax reform that can enhance innovation and recommit to progressivity. And there were 3 areas in particular that we wanted to suggest required greater examination. First of all, tax expenditures. That is, non-refundable tax credits and tax deductions that have grown prolifically in recent years should be re-examined. Some need to be expanded, some need to be coordinated, and some perhaps need to be eliminated. But they should be re-examined in the light of these basic principles. Secondly, there's been a lot of discussion in Canada about the importance of a wealth tax, which comes with some very important limitations. And we thought that it was appropriate to consider the implementation of an inheritance tax because it addresses some of those limitations. Canada is one of the few OECD countries without some form of inheritance tax. And finally, corporate tax might be re-examined as well. And we thought it was worth considering the possibility of renovating corporate tax along a cash flow taxation principle as has been recommended for a number of OECD countries, including Canada. And finally, we recommended a provincial and federal commitment to enhancing public goods, both the goods and services that are currently in place, but also to consider expanding access to public goods and services, particularly those that would enhance economic growth, such as the extension of education to include early childhood education, which might lead to greater participation rates for the parents of greater labor market participation rates for the parents of young children. And secondly, access to basic technology, which would include an investment in rural broadband, but also an assurance that urban families have access to the technology that's becoming increasingly important in education and in work. Thank you. I think I'll pass it over to Richard at this point.
Thank you, Evelyn. Next slide, please. I also want to thank all the many members of our team that aren't here. Some of what I'm saying, in fact, most of what I'm going to be saying comes from them. So they take the blame as well as the credit. One of the things, looking back in order to look forward, we recognize there was a lack of preparedness, and I don't think anybody really suggests otherwise. How can we be better prepared in the future? And we know that there will be a next crisis. What we don't know is what it will be. Will it be a health crisis, or will it be another pandemic? Will it be antimicrobial resistance, so our antibiotics don't work? Will it be a climate disaster? Will it be financial? We simply don't know. But what we can be assured of is that there will be one. It might be tomorrow, hopefully not, next year, 10 years, 20 years, but it will happen. And we've known this. I mean, we've seen over the last 20 years of this millennium that we've had serious crises. And in each case, we were unprepared. And we know we ought to have been prepared. But the little planning that we have done, we have often put aside or not implemented because in the short term, there's very little political
desire to invest in things for a potential disaster. We're hoping that after the really strong negative consequences of this pandemic, that Canadians will see the value of investing for the future. One thing we did do after the last pandemic is create PHAC, not exactly as originally suggested by the Naylor report and others, but PHAC did play a role here, and we should highlight it, in at least coordinating federal, provincial policies, at least on the health side. But there was no planning regarding innovation. How do we innovate ourselves out of this? The vaccines, drugs, etc. Financial support, we did nothing in advance, education, etc. We had no planning of how we would move online or otherwise. Next slide, please. So what do we recommend? And we have a series of recommendations. I'm just highlighting a few. One is, and this is a perennial recommendation, there is nothing new in what we're saying, but it is over and over ignored. And that is follow through on a commitment to building an innovation ecosystem. Government started to introduce the word innovation into public policy under the later years of the Harper government. It was repeated in this government, but we haven't seen any serious move in that direction. With the pandemic, we've seen it take a back seat. And innovation is not just about creating wealth, which is really important, but we actually have to innovate ourselves so that we are prepared for the next pandemic. We already saw for this pandemic, because of SARS-1, the NIH, and that led to the Moderna collaboration, was in a position to quickly develop a vaccine. So we were lucky that we had SARS-1, but we had no proactive innovation policy that would have brought us the drugs. We could have developed drugs in advance, parked them on the shelf, and we could have been out of this several months earlier. One of the things, so that's on the innovation front. Another thing is, how do we make decisions? And here it was done ad hoc because everything was done at the last minute. But what we do need is to be sure that the voices expressing themselves at the government table actually represent both a broad range of expertise, but also the community. So for example, when Ontario was considering reopening schools and they went to sick kids, there wasn't a teacher on board, right? Was this a realistic option or not? And we just simply did not build into our decision-making structures people who could speak to mental health and other issues. We tended to first defer to the public health experts and then to small businesses lobbying for opening much too quickly. We also didn't have the data sets available to enable us to actually see what was happening as it was going. We know that this crisis affected minorities, women particularly, but we didn't have good data to follow that. And so we weren't in a position to be able to advise the government rapidly enough about what was going on. And finally, there's been a somewhat lack of public trust. We have mixed messages. We have the provinces saying one thing, federal government not necessarily saying the same thing. We have public health officials changing. Now, knowledge does change and we do need to change with it, but there has to be a process and transparency so that people understand when there is a change of recommendation, it's actually based on new knowledge. Because of all the contradictions we had, for example, everybody locked down and then suddenly the provinces said, well, you can send kids back to school. Well, if I can send my kids back to school, I can see my neighbor, I can do all other things, so they seem less dangerous. We haven't had a really thoughtful and clear communication strategy. Lindsay, you are next.
Oh, thank you very much, Richard. It's this seems poignant to follow here. So we can just move to the next slide. And I'm sure there's lots of people listening in who can relate to a lot of the things that have been said here, particularly who's been hardest hit by this pandemic. That is still going on, particularly for those of us in Western Canada or anything, I guess Quebec all the way through to British Columbia. We're all still dealing with it. And it's hard to start thinking about the recovery, but we absolutely have to start thinking about the recovery, and we have to start thinking about what we're going to focus in on. And, you know, even before we're able to roll out that full inoculation from the vaccine, the health crisis is going to abate. And this is where we have to start focusing in on how do we trigger an economic recovery, and how do we think about stimulus in an economic recovery post-pandemic that had the kind of implications that it had. And so what we're saying here is, and I know people have heard this from other people before, but we did write this was written like a couple of months ago. So it was ours first. We're going to build back stronger, right? I mean, I know that there are some people who might roll their eyes at it, but those of us that were hit hard by this pandemic, from schools shutting and daycares closing, from having to be exposed from the virus and what that means in terms of having to isolate at home, and how do you maintain your household? How do you pay your bills? How do you do all of these things while we're going through it? And we need to actually learn from all of this and think about investments that we are going to make. We need to trigger that investment. That means the businesses are going to have some degree of certainty as to what's going on. We are absolutely going to need to incent behavioral changes. And we have to support society to reduce the frequency and intensity of these future shocks. Those individuals, particularly women, Indigenous people, racialized communities, low-income workers, frontline workers, there was a big impact on them, and we have to do a better job of supporting people through these shocks to make sure that the shock doesn't keep going on as it is right now. So what we're looking at is we need to be focused on achieving a sustainable, resilient, and inclusive recovery. It is not a return to business as usual. We can't keep up with the same old investment patterns and activities. We actually have to shift. And this is a great time to do that sort of shift, because we're looking at growing our investments and growing our economies. And this is a vision that has been backed by the IMF, the World Bank, the OECD, the European Union. We've heard the federal government talk about it, and it's also being signaled by major investment partners that this is a shift that is expected of governments to support as we build back stronger. So if we go to the next slide. And so there's three sort of areas to think about building back stronger, and how we can transition and how we can support that transition. And I don't think these three areas will come as any surprise to anybody who certainly follows public policy, as well as the conversations that have been going on. We have to build back with a decarbonized economy. We are already seeing major improvements in this area that will allow it. Just last week, we've learned that the price of renewables has dropped to a point that nobody expected within this time frame. The price is low. We need to sure work on storage of that. But we've hit a major milestone that we weren't expecting to hit by 2020. We have to shift to a data-driven economy. Canada is a great place to have a data-driven economy. We have cold storage right outside my window. And these are things that we can support. And obviously from this, we learned about how we need to build resilient supply chains. So if you go to the next slide, I will go through our recommendations. So we need to develop that long-term low carbon infrastructure plans to support that decarbonized economy. Includes investing in foundational infrastructure, clearly building on the renewables, as well as the transmission of those renewables and storage of those renewables are all going to be really important. And in fact, will drive investment, particularly as we're seeing our investment partners move into this area as well. We absolutely need a comprehensive and secure digital infrastructure. And in fact, one of the most important things that we learned when this pandemic hit is that we have no database of Canadians. There was no ability to deliver immediate income support to Canadians that was based on their income and their characteristics, because we didn't have a database of Canadians. That would be one area that we absolutely need to move into, and we need to join our European Union partners in this area. Ireland, the UK, Estonia, Denmark, this is all the basis of their income support system. And it is something that we can do here. And it also means being able to move into the digital infrastructure for communications and building it to withstand future shocks. We need to invest in effective and efficient labor force transitions. When we're talking about shifting an economy, there are going to be pockets of workers in industry that are going to be hit harder than others. And if there's anything that we've learned from the oil shock crisis that has impacted high-skilled, high-educated individuals in this province, is that we have to make sure that we're incentivizing them to shift industries and not wait for it to come back. And we can do that through wage insurance programs, bridge to retirement mechanisms. And this ensures that people who are able to keep working can, and that they are able to continue to participate in this new economy. And then we want to think about this undertaking our risk assessment of our exposure to global supply chains. I mean, we've learned this very early on, as well as continued through this pandemic, that there are areas that we need to improve. And that, in fact, might mean repatriating manufacturing capacity to Canada, just to make sure that we're not reliant on partners that when a crisis hits may actually not be our partners anymore. And so I think that wraps up our presentation in a fairly clear nutshell. So I'll turn it back over to Andrew to guide us through, I'm sure, questions and a discussion.
Well, very good. Thank you very much. And thanks everyone for that very succinct presentation. I'll remind anybody who joined us late, and also because I don't think I said it off the top, that the title of the report is Renewing the Social Contract, Economic Recovery in Canada from COVID-19. If you want to ask questions from the floor, as it were, can you take advantage? I'll ask people to take advantage of the chat function if you haven't already on your Zoom. And I'll start things off with a few questions, and then hopefully we can get some questions from the floor in as well. And I'll start with you, Chris. And I guess my overarching question is, how on earth did we collectively, the country of Canada, muddle this up so badly, our response to the pandemic, when, as you mentioned, we had so much advance warning, whether it was the actual experience of SARS and H1N1 or the many expert reports that had come out ahead of time? And in particular, can you home in on the degree to which the division of powers between the federal and provincial governments, federalism at least as it's currently practiced in Canada, to what extent did that contribute to some of the muddle and confusion?
Thanks, Andrew. I think that's a fantastic question. And normally, the way we do federalism in here in Canada works very well for us. We get lots of different kind of natural experiments going on, and we kind of can pick the winner and generalize that across the country, and it serves us very well. On this occasion, what we got, because we were dealing with a pandemic, and the virus is no respecter of geographic boundaries, has no interest in jurisdictional rights. What we got was large variation in policy responses, in the communication of how dangerous this pandemic was and how effective the different remedies were. And unfortunately, that actually undermined citizens' confidence in the policies that their government were proposing. And because there was variability, such variability between governments' policies, people who were understandably could see that they were going to be disadvantaged to a policy were quite rightly asked the question, well, why are you doing this when this other province is doing something different? And so we have this lack of coherence, this lack of cohesion that is problematic when you've got a pandemic. where you need consistency because the virus will cross borders and it doesn't care about jurisdictions. So it highlighted a weakness in what is normally a Canadian strength.
Richard, this too is something that has been foreseen and talked about many times in similar crises where we don't seem to be able to get the balance right between the feds and the province in this. How do we overcome this? And is the problem just provincial turf, protecting their turf, or is it a failure of federal leadership, or both? Or how do we get past this?
We're probably into a pox in all your houses type situation. Plus, we've got what's happening in the United States, and we cannot ignore that that causes some concern up here in terms of, it's hard to contain a virus up here when you've got a cauldron of it brewing in the United States. We had the worst of all worlds. We had a minority government, which serves us very well in times of peace and quiet. But in a minority, we rely on the opposition. We have opposition parties who were very provincially oriented, who wanted to protect provincial jurisdiction. We had premiers, at least in Quebec and Alberta, very assertive about protecting the rights of the provinces. And we have a constitution that in fact does give the federal government the power over health in these type of situations, but yet there's some muddling about it. We don't have a clear statement about, in a health crisis, we expect the government to come in. And so there was hesitancy at the federal level to assert that power, especially when the opposition and provinces were fighting against it. So I think we had a government that, one other factor is to deliver the goods requires provincial hospitals and healthcare systems. So even if we were to federalize it, if that's a word in Canada, you would still have to operate with the provinces. And it seemed at the beginning we had cooperation, but once the economic lobby took over and said we need to open at all costs, we had fracturing. And would have been nice at that point if the federal government stepped in. They may still step in. It's not too late. One can always hope and assert this right, but there'll be a fight about it. And that's not healthy. What would have been good if we had some signal, maybe from the Supreme Court in the cases around climate change, clearly demarcating federal jurisdiction. And then we had a federal act. The Emergencies Act is really quite general. It doesn't set up some of the institutions we need. If we had proactive measures, an act in place, and even some infrastructure available for the next crisis. So again, it's a pox in all your houses. We didn't foresee it. Canadians don't vote for it. We're all to blame, not just the government.
But Chris, this comes up, this issue again and again, and people are calling for national strategies and national approaches. And yeah, and your report does that, but it also says we have to avoid one size fits all approaches. That these involve highly varying local conditions where local knowledge is really important. How do you get that? How do you square that circle of not just running everything out of Ottawa?
Yeah, I think it's really important, and it's not simple. And that's why we as a group focus upon the idea of what's the infrastructure, what's the capacity that's got to be in place to provide a national response, and not one, the same national response to every crisis, but actually has the expertise and the resources to design the appropriate national response for a true national emergency. 99% of public health is extremely well served as a provincial activity. And you really couldn't design a national public health strategy. But there's this 1%, this pandemics, and it's true for other sorts of crises where actually we require a national response. What that response is crisis specific. And so that's why we talk about the need to create this, this capacity to design it and for it to be standing, because the scale of expenditure by governments and the scale of economic dislocation, the only real parallel to this is in times of war. And we know that the military, they war game out every different possible war they can imagine finding themselves in. They plan endlessly to make sure that they don't fight the last war, if at all possible. And really, one of the lessons we as a group think should be taken from this is if you get it wrong, the sums of money you will spend are so large that it is actually worth investing in that standing capacity to war game out a national emergency response for a whole range, almost every emergency crisis that you can imagine the nation facing.
Evelyn, one of the lessons that a lot of people take out of this is that we need to be more quote unquote resilient. And that phrase, that term comes up in your report a fair number of times. And you'll hear people saying, well, we've been too obsessed with efficiency. We've taken the division of labor too far. We've stretched our supply chains around the globe. We've been so obsessed with getting costs down, and we've left ourselves exposed. We've been too exposed to international trade. And I look at that and I go, well, if we'd been better prepared, if we'd actually done some of the planning that people had urged upon us, and particularly things like stockpiling personal protective equipment, then we could still have had the gains of trade. We could still have sourced that in the cheapest market, and we could still be carrying on with our so-called obsession with efficiency. Is resiliency really the issue, or should we be more focused on the resistance part of your equation of trying to make sure that we're better prepared and aren't caught unawares by future pandemics or other types of crises?
I think it's a little bit of both. I mean, as you mentioned, Canada is a small open economy. We're a globally embedded economy, and that makes us very vulnerable to external shocks. But I think when you couple that with a large number of people who are living paycheck to paycheck, who don't have the resilience, who don't have the capacity to respond to that, it means that a small shock can have major effects very, very quickly. And that's why you need to have some kind of resistance built in as well, some capacity to respond to that within the economy. And we did have that capacity. I mean, if we had, for example, an early warning system, we might have been able to respond more quickly to the sorts of things that were happening. We might have been able to manage our borders a little bit better, and so on. But our ability to resist is really quite limited, and that's why resilience becomes so important, I think.
Lindsay, this is a very ambitious agenda that you look at the sum total of this report. There's a lot of things that you recommend in there. And I think a lot of people might look at that and say, okay, those are all maybe good ideas, or some of them are, some of them aren't, but they might say, why is now the time? I mean, the people in this panel probably would have advocated for a lot of these things if there'd never been a pandemic. So why does the pandemic clinch the argument for, like if we think we need to move to a decarbonized economy, well, that predated the pandemic. Why does the pandemic make the argument for decarbonization and some of these other agenda items?
Yeah, I think it's even more important now because we have to start building an economic stimulus plan. But, before the pandemic, I mean, yes, we can all talk about whether or not the federal government needed to rein in their spending, but we weren't talking about any sort of stimulus to the magnitude of what we have to think about from this event that leads to economic recovery. And that's why this is the perfect time. We have to build multi-billions of dollars worth of recovery spending, and that should be like tens, if not hundreds of billions of dollars of investment and recovery. And so why would you take all that money and put it into industries that we know we have to transition out of? And so, yeah, to me, there is absolutely no better time. And this is a very good plan as well to help support individuals. Like, I'm in a university. We're still trying to place our students that were coming out of our program. We should not underestimate the impact that this crisis has had on our 18 to 30-year-old individuals who actually have to enter into an economy for the longer term. Well, let's build that economy for the longer term so that when they enter into it, they're not immediately going to face economic contraction in the industry that they have chosen.
Evelyn, maybe come at this in another way of what your critics might say is we're running as it is a deficit of, it's probably going to be in the $400 billion range, just kind of bailing ourselves out of the current crisis and keeping the lights on. Given how strained our finances already are, a lot of people are going to say, well, can we really afford to take on some of the really quite big ticket items that are in this report and are in some similar reports? And maybe I'll put a companion question to that is, and slightly more provocative, which is, you know, you look at the response to the COVID that governments mounted, and it was so flawed and so failed on a very core, what everyone would agree was an absolute core responsibility of government, which is managing public health emergencies. And if the government is so signally failed in that very core responsibility, how does that make the argument for it taking on a whole bunch of new and expanded responsibilities?
Let me answer your provocative question with a provocative response. I think that you are mistaken in the notion of where the source of the problem lies. I think one thing the pandemic did was to show us the price for 30 years of underinvestment in the public sector, 30 years of underinvestment in the social safety net. And now we're reaping the consequences of that. And so, I mean, I think one of the things that this report attempts to do is to move us away from the short run perspective that have driven so many decisions in recent decades and ask us to take a longer look at the economy and to think about what it means to reinvest.
Just to come back to that first part of that question, though, is how do we afford it? How do we, if we're already running $400 billion deficits and there's tens of billions of dollars presumably of additional spending in this, is it the old saw that we just simply can't afford not to?
Well, I think we can't afford not to. I think re-examining the tax system does generate additional tax revenue without necessarily increasing tax rates and causing difficulties with perverse incentives and so on. So, I mean, I think it is possible to increase tax revenue, and I think we need to recognize that we're already spending a lot of money. We're spending a lot of money trying to address the needs of people who are living paycheck to paycheck, but we're not doing a very good job of it. So, I mean, part of it is recapturing and consolidating the way we're spending that money and doing a better job of it. And I think it's recognizing that we really do have to invest in the public sector, and an investment now will lead to better outcomes downstream.
And the specific,
and I should, and mentioning it again, I mean, it's sort of a truism at this point, but I mean, when the federal government is borrowing money at 0%, this is the time to invest for the future.
the specific question, policy question that you devote a lot of attention to is the basic income guarantee. And there's a large body of literature on why this would be a good idea to simplify the system, to make it easier for people to navigate, to make sure nobody falls between the cracks, to fix work incentives. But I notice that while there's a wide range of people who support it that you wouldn't necessarily expect across the ideological spectrum, you also see surprising people opposed to it.
Yeah.
Even, for example, some left of center economists who say, look, when the cost of this thing is just astronomical. What I noticed there, though, of course, is everyone's talking about their own model of what they think the basic income guarantee means. And I'll just maybe put a specific question to you is, it's surely you can only make this thing work if it replaces a lot of existing programs. And if it's replacing a lot of existing programs, doesn't that get you into fights with the provinces? And doesn't it make the whole thing a dead on arrival?
I don't think so. I think that there's been a lot of research done on the cost of a well-designed basic income that delivers a guarantee at somewhere close to the poverty line, that focuses income on the people who need it most. And we know that we can do that within a fairly reasonable budget. The Parliamentary Budget Office has done 2.5 reports, if you include the update this year, on what it would cost to offer this kind of a basic income guarantee. And it's certainly feasible within the context of the Canadian economy. If you recognize that a lot of the money is already being spent, it's half of the cost of it is already being spent by the provinces and territories delivering income assistance. Another portion of it is being spent on, in many cases, badly designed and badly targeted tax credits at both the provincial and the federal level. A good portion of the cost of a basic income is right there without any need to look very seriously at the tax system at all. So yeah, we can afford it. We don't have to worry about perverse incentives. Is there opposition? Yes, I think a lot of the political opposition to basic income comes from the very kind of short-run thinking that we've been talking about. If you think about basic income in the short run, one group of people doing better means that somebody else is paying the cost, and that necessarily leads to the kind of disputes that we've seen. Again, if you put basic income into the context of an investment, and We talk about deficits and debts burdening our grandchildren, but we don't recognize that investing in the social safety net is an investment for our grandchildren. It's an investment for the future.
Very true. Richard, one line that jumped out at me in the chapter on innovation, and the quote says, Canada has adopted a laissez-faire approach to innovation in the private sector. And I have to say, I kind of scratched my head at that a little bit. I believe it was the Institute for Fiscal Studies said we've got 147 different programs encouraging innovation just at the federal level alone. Subsidies to business, which are often justified in the name of encouraging innovation and competitiveness, et cetera, adds up by one count of the University of Calgary professor to $29 billion a year. And indeed, in the report itself, there's several examples cited of attempts to try to state manage and state direct innovation that turned into abysmal failures. That whether we're talking about the attempt to make universities into patent houses, or encouraging artificial intelligence, it says 8 to 10 years too late, or people trying to turn us into a global pharmaceutical power. How do we credibly argue that the problem is that we've had a laissez-faire approach to innovation? Surely it's the opposite.
Well, it depends on what you mean by laissez-faire. We've got lots of spending, but it's random spending driven by industry priorities. So it's the firms that decide what to research, and then we give them tax credits willy-nilly. So the laissez-faire part is who's making the decisions. It's industry and a perverse tax system that's doing it. And so that's what we mean by it. If you mean that there's no, government's funding university research and attaches conditions to it. So if what you mean is a pure ideal state of libertarianism, no, but that doesn't exist anywhere in the world. But if you mean that it is not directed, and that the federal government doesn't have a plan, and the provincial governments don't have a plan, and it's left up to industry, if we provide them with random tax resources, they will come. That's what you mean by laissez-faire, that's the situation we have. And innovation policy analysts have said for decades that this has been a problem, that we have no central goals. So if we go back to Lindsay's point in your question about why now, well, we need to build up wealth. How do we do that? We have to pick where we're going to throw our money. We could throw it in industries that are going to die and just suck it up and throw it away, or we can align our incentives for the industries of the rest of the 21st century. But part of that is saying to industry, if you produce products in this field, we'll either buy it from you through procurement, or we'll provide particular incentives. So some direction, not in terms of technology by technology, because that's going to be a failure, but saying, we want you to move in this way, and we will be there to help you. So that's what we meant by laissez-faire, is that there's been never really an attempt to lay out where our priorities are, where the missions are. We've always left it to the private sector to decide what it wants, or the universities, and neither one of them has been able to do it.
Chris, just back to you for one last question, then we'll throw it open to questions from the floor. But in the chapter addressing how do we approach pandemics better in the future, one aspect that is touched upon is trying to avoid the kind of, I guess I'll say, tunnel vision that at least arguably authorities had in this pandemic, where with the best will in the world, they were listening very closely to the public health experts saying do X and Y and Z, but weren't necessarily, and this is not to diminish the expertise of those public health experts, but they weren't necessarily taking the larger view of balancing off all of the different social trade-offs. And we kind of jerked back and forth between total lockdown and then opening up too soon. And how, beyond just saying, well, we should do it better next time, what concretely can we do to try to make sure we have a more holistic approach in future?
And that's exactly where we started as a group this conversation, Andrew, this frustration of the over narrow siloed discussion. And that's how, thinking about how to not do that was what led us to think about this creation of a standing crisis response capacity that had all of the different expertise. So not just public health, but kind of a what you might call a one society lens. So all of the experts were involved and inputting into that, so that when the crisis hit, the conversations and the policy proposals that were on the shelf were already enriched and had hardwired that pan society, one society lens, rather than trying to reverse engineer it into the discussions as we've had to do going along with this pandemic crisis.
Very interesting. Okay, let's have a few questions from the floor here, and I'll start with Gary Slater at University of Ottawa. And anybody who wants to tackle this, please jump in. Many Canadians are worried about tourism and travel industries. What should we do to sustain these sectors? Anybody got some thoughts?
Sorry, I was distracted by a 7-year-old there.
I'll repeat the question is what can we do to sustain the tourism and travel industries, which have really taken it maybe some of the hardest of any of the industries in this pandemic? Is there anything that springs to mind, or is it just basically give them the same support that we give to other industries?
I think really what's important is I think everybody forgets, and I know I have a lot of frustration what's going on in this province as well, is that the economy is not just a mystical, magical thing, right? It's us. And so if we as consumers don't have confidence, we're not going to be spending our money. So without getting the virus under control, we just will not have an economic recovery. And if the virus isn't out of control, there are certain activities that are just not going to happen, or people are only going to elect to do them if the risk reward situation is, highly tilted on the reward side and not the risk side. Tourism, the arts, travel, restaurants and bars, this requires consumer confidence, okay? And so these are interlinked. Is there like a magical thing we can do to support these industries while we get this consumer confidence back? Consumer confidence actually takes public policy. And yeah, we can absolutely support these businesses through, but it's really important for people to understand. I always hate being the economist in the room. That businesses, businesses went into this pandemic with an incredibly heavy debt load. And that debt load was in fact incentivized by public policy. Some businesses are not going to be able to withstand this. It doesn't matter what kind of economic power and policies we put behind it. They just didn't have that degree of assets behind them to be able to do that. And and I know it's really hard to say this, and it's really hard for people to accept this. And I know what I'm saying, it's awful. Some of these businesses are going to have to go out of business, but then that brings in what Evelyn has been talking about. If we have a safety net that includes self-employed business owners as well, then we will all survive this. We're all in it together. We are in fact all in it together. And I haven't been economically impacted, and it is in fact my job to pay my taxes in order to support other people who have been heavily impacted by this.
Speaking of people who have been heavily affected, this is from John. He doesn't give his last name, but can there be any recovery, economic and social, if there's no national policies and support for the elderly, especially those in care programs? They are most at risk. Whether or not it's a national approach, there's clearly federal or provincial, we let our elderly down. And what lessons can we learn for the future beyond do better in how we support and look after the elderly? And whoever wants to jump in.
I can point out there was a whole report just on that. So we didn't go into depth on this particular issue. First of all, we don't have the expertise, but there is a whole report on it. But again, it goes back to if we have a good economy and we restart in the right areas, we will generate the wealth that we have the potential to do this. Then there's the whole decision making and how one makes decisions. But for that, I will refer to the first report that came out of the Royal Society, which was aimed at this very question.
Kate Besenson asks, this economic crisis has hit women particularly hard and has been called by some a she-cession or a pink collar recession. How does your vision attend to the gendered and other inequality dimensions in recovery? I think this is right in the whole panel's wheelhouse, but whoever wants to take it.
I'll take that. Hi, Kate. How you doing? You know, I mean, one of the key areas that we have, I think it was in chapter 5, is that we absolutely have to do public policy from a gender-based analysis intersectionality lens. And despite the fact that I live in a province where my premier called that kooky, this is incredibly important for understanding the impacts of society, understanding how our policies help everybody, and ensuring that those who are hit hard are able to recover. Well, all of the last recessions have hit men hard, and that doesn't never have seemed to have come to a problem in the heads of politicians. The fact that this one hit women harder seems to just have a lot of politicians are really struggling with understanding and accepting what that means. And so it's about making sure that we understand that, you know, women are workers, we're also predominantly caregivers, and there absolutely needs to be policies there to support us, like early childhood education, as well as shifting society so that these are things that are shared. They're not just uniquely fall on women or parents. It takes a village to raise children, and that was one of the biggest impacts that this pandemic had, was women having to work while raising children and managing a household all simultaneously. It's incredibly stressful. And yeah, that would be a few things that I would say on that topic.
Okay, I think this is going to be our last question from Colleen Flood. And she asks, there was a move by governments to quote unquote recovery immediately after the first wave, even though it was clear we had not tamed COVID-19. I guess if I can summarize your question, she's saying, how do we avoid that in the future? That there's always going to be that temptation to say, okay, crisis is over, let's get back to business. And how do you get people singing off the same sheet and paying? I guess this is the opposite of my earlier question about how do we get them to take a more holistic view and not just focus on the pandemic, but we've seen equally and oppositely the problem of taking our eye off the ball too quickly and deciding that the show's over and we don't need to worry anymore. So is there any concrete recommendations you might have, anybody on the panel, for how to keep our eye on the ball and not declare victory too soon?
I can jump in. Oh, Chris, if you're...
Oh, you go.
Okay, well, Chris and I had many conversations about this, including earlier today. I mean, this was completely predictable. When Quebec opened and then Ontario opened in May and June, I think Chris and I, we didn't get the number right and the exact week that we would have this, but it was obvious we would be in the situation we are today because exponential growth is exponential growth. The problem was, and this goes back to what I was presenting before, we don't have good data. So the people who would have been expected to go to the government and say, this is what's going to happen. We didn't have the modeling done. We had it by public health people, but not economics, lawyers and others. We didn't have that. So there was no communication to the governments about this cost. And yet the small businesses, the gym owners, the restaurants were all saying, we're suffering. And governments made a decision that it was pretty obvious to those of us who were playing with models based on, you know, kind of our gut feel and our knowledge of the growth of the virus that this would happen. So we're hoping that if we set up these mechanisms where we can get these multiple voices and we have good data, we can counter the argument that we should open earlier. Chris, I don't know if you want to add.
Very little, just to really to re-emphasize the data and the right experts in combination can ensure that the decision makers have sufficient understanding to actually respond to the inevitable pressure to move quickly by those who are bearing the burden. You know, at the end of what people hoped was the first wave, I had huge sympathy for the decision makers because they really didn't have the evidence to confidently push back on the pressure they were getting. And we must not let that happen again. We need to have the infrastructure and the expertise in place to give the decision makers the evidence to respond to claims for exceptions or rapid changes in policy. Absent that, they have to go with their best judgment, and I don't want to give them a hard time for that.
Well, thank you, Chris, and thank you, everyone, for a most stimulating discussion. And again, we've been talking about the report of the RSC's COVID-19 task force, that report called Renewing the Social Contract, Economic Recovery in Canada from COVID-19. It's a most worthwhile read. And with that, I guess I will pass it back to the unseen authorities who are running all of our lives right now.
Thanks a lot, Andrew. That was brilliant.
Great, thank you.
Thank you, Andrew.
Take care, everyone.